Hello everyone. Today I would like to present you the study titled Sensor Integration and Postural Control Across Development. I would like to thank my co-authors, Almazloum from the Physical Therapy Department and Katsavelis from the Exercise Science and Pre-Health Professions at Creighton University. The clinical test of sensory interaction for balance is a simple and effective test in adults to identify and assess deficiencies in sensory integration. It has been developed many years ago and has been used as a very valuable clinical test for sensory interaction, especially for older populations. It has also been used for the pediatric population, but not as much. The test challenges its primary sensory system, like the somatosensory, visual, and vestibular, to identify which sensory inputs the body relies on to maintain balance. Currently, there is limited information regarding how the SID-SID, in combination with forced platform technology, can help us identify how sensory motor integration develops in children. And we're asking that question because now forced platforms can be used in multiple locations. They are very portable, and they can be found easily in a clinic. And in combination with this test, they can actually replace a more expensive test like the Neurocom would be, or some other platform that costs a lot of money. So a combination of this tool with a forced platform might be able to give us very nice information about the development of sensory integration in children. The purpose of this study was to capture sensory organization age differences in typical developing children between 4 and 16 years of age. We included 3 groups of children: 6 children in the 4 to 6-year-old group, 5 children in the 7 to 10-year-old group, and 4 children in the 11 to 16-year-old group. Unfortunately, due to COVID, we were not able to continue collecting the data, but we are slowly starting to restart this project. We collected center of pressure data while performing the SID-SID test. The SID-SID test includes 6 conditions. So the first one is eyes open, standing on a firm surface. Then condition 2 is standing on a firm surface with eyes closed. And condition 3 is standing on a firm surface while having a visual dome around the head. So it's a sway referenced vision. Condition 4, you're using compliant surface like a foam pad and you have eyes open. Condition 5, you're using again a compliant foot support with eyes closed. And condition 6, the most challenging condition, you have the compliant surface but also the visual dome around the head. So you are manipulating the vestibular and somatosensory information at the same time, and they need to rely more on the vestibular system. Here on the picture, you just see a child performing condition number 4. Actually, she had her eyes open under this condition and just using that foam pad as a compliant surface. For the center of pressure data, we use linear and nonlinear measures in both the anterior, posterior, and medial lateral directions, AP and ML. And linear measures account for the magnitude of changes, whereas nonlinear measures account for the temporal changes in the COP signal. I will start with the results from the linear measures. I present you here just the range in the anterior, posterior, and the sway path. Range in ML and both root mean square in AP and ML directions showed very similar graphs. You see the greatest changes happens, or the greatest variability is within the group of 4 to 6-year-olds, and very different responses with regards to condition, whereas you see that plateau coming between 7 to 10 and 11 to 16-year-olds. Again, the most challenging conditions seem to be conditions 4, 5, and 6. That's why you see the highest values in the range in AP direction. The sway path tends to have a more clear and linear type of behavior as you go from the youngest to the oldest children. You see that reduction in the sway path across conditions, and that's very evident. It's actually, it was actually significant when we ran some non-parametric statistics, but we're very hesitant due to the low number of subjects per group to use that, but at least we have some good preliminary information. With regards to the nonlinear measures, sample entropy in the anterior-posterior direction that I present you here was very similar in the mediolateral direction. You see that it's a little bit different. The highest values were in the group of the 7 to 10-year-old, whereas similar values were between the group 4 to 6 and the 11 to 16. The most challenging conditions 4, 5, and 6, tended to have the lowest sample entropy values, which means that the children tend to engage into a more repeatable pattern of behavior in comparison to conditions 1, 2, and 3. Overall, the values of the linear measures of COP reveal the decreasing trend from the youngest to oldest children, whereas that was different with the nonlinear measure of sample entropy. Sensory organization differences are evident among the children of different ages, and we should take into consideration for better learning outcomes. And we would like to use this protocol in the future to capture sensory organization differences between typical developing children and children with autism spectrum disorder. To the funding source and to all the children and their families for participating.